to reflect on their current rate of vaccination and the risk in the community and review whether that mandate of a third dose in workers should be maintained.
Next question.
From Charlie Pinkerton at Queen's Park Briefing.
Hi, Dr. Moore. My first question is about some newer vaccines against COVID-19 and newer to us here in Canada. That of Novavax and Medicago's, which I believe the latter of which was approved today. A couple months ago, you were speaking about Novavax's vaccine, and you shared an opinion with other experts that I've heard that because of the technology it's based on, it's a more, familiar vaccine to some people, unlike those of which are based on mRNA technology. Do you think the province should reach out to the federal government to try to acquire doses of these vaccines, or has Ontario sort of gotten as far as it will in terms of its effort to vaccinate as many people as possible with vaccines it's already received?
Oh, thanks so much, Tony. So we're actually very excited about both the Novavax and the Medicago products. They are proving to be highly safe, highly effective. They are more of a traditional vaccine, and that may have appeal to the 10% or so of 12-plus population that haven't received a vaccine as of yet. So we are working with the federal government to get, I would believe, Novavax will be the first product available. It should be available second or third week of March in Ontario, and we'll communicate that directly to all Ontarians. I hope that the 10% of Ontarians, adults 12 and up, would reflect and review this product with their healthcare provider and see if it's right for them. It is highly effective against multiple strains of COVID, including Omicron. And we think it'll be available in significant amounts the second and third week of March. The Medicago product, we have heard just recently that its delivery to Ontarians may be delayed several months. So we may not hear of its availability confirmed till maybe May or June. So of all the products available, Novavax to me is still exciting. It's a traditional vaccine where the protein, the recombinant protein, is being injected. That's how most other vaccines work, like influenza. You'll build antibodies against it, and then your immunity, both cell-based and antibody-based, will continue. It's two-dose vaccine at present, and it's I think it's a great alternative for those that didn't want an mRNA vaccine. That it is more of a traditional technology, and I hope it does appeal to some who have yet taken advantage of our vaccination strategy.
Follow-up.
Okay, great. Thanks. Thanks for that thorough answer. Once the Health Ministry directive regarding vaccination policies for hospital employees is lifted, is it going to be your advice that it would be a greater benefit for hospitals to rehire nurses who lost their jobs because they didn't meet their hospital's vaccination policy? Or, would it be better for these nurses to not be rehired because of the additional risk that they would still continue to pose?
So thanks for that question. I just have to be clear. Directives from the CMWH office are meant to be time limited, and they are to be an immediate risk to the health of the population. And so we are forced to review any directive that's in place, given that we're at a different phase of the pandemic, and the risk is decreasing day by day. So it is always necessary for me to review all directives that are written by the Chief Medical Officer of Health. So I don't want anyone listening to say I don't endorse immunization of healthcare workers or policies to immunize healthcare workers. What we're asking now is if the directive has to be removed, we're asking all of our healthcare partners to reflect on their current policies. I would suggest they do adopt an immunization policy for new hires, especially, and or for those that were let go, and that the corporations that have let any individuals go have to reflect on their policy. But we won't be prescriptive in any way. I absolutely 100% endorse anyone providing care to a vulnerable member of our community to be immunized.
Last question, unless someone else joins the queue.
From Jeff Gray at the Globe and Mail.
Oh, hi, thanks. I just wanted to ask about the mask policies that you're looking at lifting. You mentioned lifting them all simultaneously as the goal, but would there still be holdover mask mandates or mask policies for, say, hospitals or long-term care or maybe even public transit? Is that something you'd consider?
Thanks very much, Jeff. I would absolutely want to reflect that high-risk settings, such as public transit, such as hospitals and long-term care, would maintain a masking policy beyond when we appeal it for general indoor settings for Ontarians. So the highest risk settings, I think we've learned that the masks have benefit. They reduce the risk of spread of multiple different pathogens, not just COVID, and have provided a safety net that is necessary in those high-risk settings to so many vulnerable patients and populations. So we will be reflecting on where we would maintain them, and I think you're right, at the highest risk settings we would want to maintain them, but always reviewing the policy over time and eliminate them in more general public settings, eliminate the mandatory nature of them. We're doing ongoing jurisdictional scans of lessons learned. So we're looking at England, where they're maintaining it in public transit, on the tube in London, for example, and they're maintaining it in their long-term care settings and acute care settings. So we're trying to learn best practices globally and provincially, and as the risk decreases in Ontario, make recommendations to government with that in mind.
Follow-up?
Thanks for that. And going back to your comments off the top about wastewater, declining, the signal, the amount of COVID we're finding in wastewater declining or stable. Are you still seeing, though, increases or worrying levels in certain public health units or certain areas of the province of Northern Ontario? Are we still seeing a rise there, or are those tailing off as well?
Yeah, in particular in the Northeast, we're seeing a rise, and we're seeing stabilization in some of the wastewater settings across Ontario. And I'm learning through that surveillance system, they can break it down by water treatment plant, even within a city. So in Toronto, for example, you could see an ongoing risk in certain neighborhoods in the north of Toronto. So at present, the highest risk areas where we're seeing an ongoing rise in wastewater surveillance is mainly the Northeast, but there are pockets within cities and or within communities where we're seeing ongoing risks. So even though, and this is an important message, Jeff, even though we're reducing capacity limits in certain settings and opening the economy, the risk does remain. We will see ongoing transmission, and the wastewater is a reflection of that ongoing risk of transmission. It's not down to zero in any community in Ontario, but the rates are stabilizing, and our health system is stabilizing and has capacity to care for people who get ill from Omicron. But the risk remains, so please continue, wear your mask, wash your hands, come forward to get your first, second, third, or fourth doses of vaccine because it's not gone yet.
Last question.
From Rob Ferguson at the Toronto Star.
Hi, Doctor. Just wanted to clarify or make sure I understand what you said earlier about when you were asked about masking in schools. You said you would look to remove the masking in the public sector and schools in the same time, and I wasn't quite sure how extensive you meant to be by saying public sector. Could you just give us a little bit more detail on that? Yeah, so I meant indoor public settings. Outdoors, with appropriate distancing, I wouldn't
make any mandatory recommendation on masking. But indoor public settings, depending upon how many people are in a setting, we will be reviewing the recommendation on masking in that environment. And the general feedback from the community members that we've sought feedback from at present is if you're going to lift them in recreational facilities and in other indoor facilities, it just makes sense to also do it simultaneously for educational sector.
Follow up, and this is the last question.
Okay, understood. Thank you very much for that. And I'm wondering, given your answers to Jeff there just a minute ago about, excuse me, about the wastewater indicators, given it's taking place in certain pockets in northeastern Ontario, certain pockets of cities, who is still getting COVID at this point? Is it healthcare workers? Can you just pin it down a little bit for us on what the most risky kind of situations are?
No, just want to confirm that we're seeing ongoing spread at a community level and across all age groups. It can, from the PCR testing, it remains that 20 to 40-year-old age group. It appears to have higher rates, but it's a biased sample who gets access to PCR. From a hospitalization vantage point, it's the older age groups that are having higher rates of hospitalization, and that's been consistent across the pandemic. 50 to 60, 60 to 70, the age group risk increases, and that's why it comforts me so much that 86% of those over 70 have gotten their third doses. If we can, I would absolutely endorse more Ontarians coming forward for their third dose, especially if you've got any underlying chronic illness, any risk that would predispose you to hospitalization for COVID-19. Please come forward and continue to get your dose, because the risk is still there in communities. The virus is still present. It's just that the impact on the healthcare system has stabilized.
Thanks, everyone.